ce système EOS est initialement fait pour diminuer la dose de radiation, ce qui est bien sûr tout à fait louable, étant donné que la radiation dans le domaine médical, sur les 30 dernières années, a augmenté de 600% pour la population générale, avec toutes les radios, scanners et autres imageries qu'on demande.
There's always been some concern with that, but I think in the last decade there's been even heightened concern amongst our patients. I have many more patients, especially their parents if they're children or even older patients, asking about that, about the repeated radiographs that they obtain upon clinic visits, and their concern for excessive radiations.
And that component of putting the patient through the X-ray process is so much simplified by stand in the EOS machine, have your scan, check, make sure you got the image you want, and that maybe there wasn't any motion artifact, and move on. So I think we've really simplified the process for the patient, and we've simplified the process for the radiology technician.
With that unique ability to analyze the entire body simultaneously, the AP and lateral images will provide a definite means of figuring out all of these interrelations, which I think are critical to the true understanding of spinal pathology and ultimately spinal treatments.
Maintenant, on a bien compris que pour la colonne vertébrale, le full body était un élément important dans l'appréciation générale, parce que les problèmes de la colonne retentissent sur tout le reste, tout ce qui est en dessous de la tête en gros, est impacté par les problèmes de colonne.
So the ability of a three-dimensional reconstruction system to allow us to obtain a top-down view or a view from along the spine from below, whichever you prefer, gives you that transverse plane imaging that we just haven't been able to see except during surgery with our own eyes. So now that really changes how we view scoliosis.
Not only the spine is important, also, let's say, lower extremities are very interesting because you can really assess the real deformities of the lower extremities, not the projected deformities, but the real deformities. You can measure exact angles in the 3D space, not only projected angles, and you can measure exact distances, and that's very important for planning of the surgeries because the exact planning is really the prerequisite for a good treatment.